Welcome to the Buckingham Center for Facial Plastic Surgery. In this video, we're going to discuss otoplasty, which is the medical term for molding the ear. Some individuals have an ear that protrudes from the side of the head more than they would like it to, and they're self-conscious about the appearance of that. So they come to me to reshape the ear or pin the ear back to give it a more aesthetically appealing appearance. That procedure is usually done here in the office unless it's a young child who would be intolerant of having local anesthesia here in the office. So if you're, say, age 5 to 12 to 15 or so, we would take that individual to the surgery center and use a little deeper level of anesthesia. But if you're a teenager or above, this is a procedure that can easily be done here in the office, either with just a local anesthetic, so injecting lidocaine, or augmented with a little bit of oral sedation to just relax the individual. The procedure itself is done by making an incision behind the ear where we elevate the skin off the back of the cartilage. The cause of ears being protuberant from the side of the head is usually twofold in nature. One is that this crease, called the antihelical fold, tends to be flattened, and so we need to create that crease or fold in the ear. And the other reason is because this part of the ear that's kind of inside, we call it the conchal bowl because it looks like a bowl, is too protruded or away from the ear or the side of the head, or sometimes it's a little bit just too big in size in general. So the correction for that is usually twofold, and both are done from that incision and elevating the skin from the cartilage to the back of the ear. So we utilize a suture that's actually made of polyester, so it stays in there forever, but is hidden and isn't visible and doesn't usually cause trouble down the road, to make that new fold and to suture this cartilage back down to the fascia behind the ear. So we're literally folding the ear back. Then it's just a matter of closing that incision in the skin. We wrap the patient up with the dressing overnight. They get to go home and come back the next day where the dressings get removed. We then re-wrap the individual for 2 more days. They take that dressing off at home. They then continue to wear a soft headband for the rest of the first week, and then a soft headband at night just to prevent them from rolling over and disrupting the ear in some way. Socially, individuals are back as soon as stitches are looked at, which they're absorbable behind the ear, but we still tend to kind of clip the knots out of them. But generally after 1 week, individuals are able to start being out and about and social when they're done wearing the headbands. And the final result is usually as soon as 6 weeks. They're able to get back to physical activity of most types at 2 weeks and anything they want to do at 3 weeks. So the procedure is actually relatively quick, not very much pain involved, very consistent, and the results are usually very well appreciated by patients. Thanks so much for listening, and we hope to see you soon.